It's great to have you all here at the monthly Psychedelic Support Speaker Series. I'm your host and co-founder of Psychedelic Support, Allison Fiducia. Today, we're going to be having a conversation with Jaime and Drew, who I'll introduce in a moment. They're going to be talking about the Integrative Psychiatry Institute's year-long psychedelic therapy training program, otherwise known as IPI for short. And we started promoting this program over 2 years ago because we found that it is a comprehensive curriculum. It has lots of great expert presenters that are involved in the program. There's small groups and discussions, which we'll be hearing a lot more about. And furthermore, we've consistently heard great feedback from students that have undergone training with IPI. I worked with the co-founder, Dr. Will Vanderveer, on some of the MAP-sponsored MDMA trials and feel that the approach of integrative psychiatry or looking at the whole body, mind, spirit is a great way to incorporate psychedelics into clinical practice and other types of psychedelic practices, which we'll learn more about. So it's been fun to watch this program expand and continue to increase the learnings and offerings through their program. If you feel that you meet the criteria, which we're going to go over today, you can schedule a complimentary call. And if you aren't ready quite to sign up for a year-long program or you don't meet the criteria, we do have lots of courses on psychedelic support that you can do in your own time. And we currently have our annual spring sale going on where you can get 30% off our courses. You can access the video of this call after on our professional speaker series page. I just dropped the link here to the training program as well as where we'll place the video, or if you want to join our next month's session, we'll have that up soon. So now I'll go ahead and introduce our speakers today. We have Jaime Davila, who is a licensed professional counselor in the state of Colorado. Inspired by his own healing journey, Jaime dedicates himself to understanding and advocating for the responsible and therapeutic use of psychedelics in mental health care. He has worked in community mental health as a child and family therapist and as a ketamine therapist at the Integrative Psychiatry Center. He participated in the first cohort of IPI's training program and now currently serves as the director of psychedelic training at the IPI program. Drew Snyder is a professional counselor in private practice in Oregon and specializes in psychedelic-assisted psychotherapy. Drew discovered firsthand what a profound tool psychedelics could be for healing during his own therapeutic journey, recovering from moral injury as a combat veteran of the U.S. Army. He then immersed himself in comprehensive training in the field through the Integrative Psychiatry Institute in conjunction with MAPS, as well as the Bodhi Academy. He is head of IPI Psilocybin Practicum, which we'll be hearing about today. So I'm going to hand it over to our speakers, but if you have questions along the way, you can drop them into the QA section, which is in the bottom dashboard at the end. We'll go through as many questions as we can. You can also chat with each other in the chat here in Zoom. Just make sure that you switch it to everyone rather than just the panelists, unless you want your question or your comment to only come to us. We encourage you to introduce yourselves and say where you're calling in from there in the chat. And yeah, let's get going here. Welcome,
Great.
Drew and
Thank you.
Jaime.
Thank you, Ali. Thank you for having us. Yeah, I guess I just wanted to share a little more before we drop into the program, just a little bit more about myself and how I ended up in this position. You heard a little bit about that I was in cohort 1 and got to participate in the program in that capacity. And from there, my experience kind of just grew along with the program. But similar to Drew, you know, I think many of us have this personal calling to the helping profession, right? And I think, you know, I came from aerospace where I was in the Air Force first, and then went on to work at Boeing and Lockheed for a total of, you know, about 17 or 18 years. I worked in the aerospace industry. And it was my journey through my own exploration of my depression that went all the way back to childhood up into my 30s on trying to figure out like what exactly was wrong, like what was wrong with me, like why was I living a life that felt very mundane or kind of dead inside. And through the exploration of different working with different counselors and trying medications and finding a lot of the things that didn't work, I had kind of reached a point of desperation. And reaching out to a friend during that time, they invited me to participate in an ayahuasca ceremony, which I had researched and had watched documentaries on, but had never really thought that I could access those medicines within the United States. And I was able to do so at a church in Florida that has legal protection. I was able to participate, and that one experience was incredibly profound and incredibly challenging. But it woke me up inside in a way that I had never felt before. And when I felt that in my body, I had this new sense of hope that maybe there was a way to live a life and to create a life that felt alive for myself and my family. And so it was through that process that I got engaged with psychedelics. My father was in law enforcement in the army, and so I grew up in a household where there was no experimentation, no exploration allowed. There was just no tolerance for that. And so, as an adult coming into this, finding my healing journey and finding the community and supportive therapist that allowed me to grow and get to the point where I am in my life today, which I'm very fortunate. And I feel a sense of gratitude for all of the experiences and all the people that held me and supported me along my way. Um, I came into IPI during the COVID time, ended up working at the clinic during 2020. And as the program started, just was able to participate in the development of the program and was very fortunate to be able to work many ketamine weekends with many of our students and was also able to get to visit Drew up in Oregon and help with getting things going up there. Um, yeah, and so I just wanted to share a little bit more of my background so you know kind of my lens and why I feel like such a strong advocate for this work, and especially for the education and the need to do our own work and how that is an ongoing process for us. It's the most one of the most important things we try to communicate to our students in the program is that while it is an educational program, it's going to challenge you in a way that maybe may make you uncomfortable. And so I just want to be clear that while it's an educational program with experiential components, it's really, really important that you come in with the mindset that this in itself is going to be a journey of growth for you, similar to how perhaps your master's program or your doctoral program challenged you in those ways. And this is another component of that with an experiential medicine component that just amplifies the experience. And so I just wanted to communicate that so that folks understand what you're stepping into is a big journey and it shouldn't be taken lightly. Thank you for the time. I'll hand it off to Drew now.
Hi, everybody. It's so lovely to be with you. Really excited to share the program that we've put together and tell you a little more about it. And like Jamie um, experienced, I also had a similar experience of coming out of the military, and I actually had a diagnosis of PTSD. And I was on all of the medications you could be on and medications for those medications and the side effects. And those were helping me be functional, but barely. And I was doing a lot of therapy and trying all the modalities. And I just was not, I felt stuck and I wasn't getting to the place that I really wanted to be at. And it was affecting my family. I've got 4 kids and a wife. And I when I knew I wanted to become a therapist. I was working on my master's, and I started hearing about how psilocybin could be effective for treating PTSD. So I dove into the research, and I grew up very conservatively, and so never any experimentation of any kind of substance, and so this was outside of my wheelhouse for sure. But the more I read all the research, the more convinced I was that this could be a really helpful tool to turn a corner. And so I managed to find access a psilocybin journey in a therapeutic context, and with a lot of intention. I had actually two journeys, and it was such a profound change for me, and it really was the thing that helped me to get past my psychological defenses and to really access the things that I was struggling with on a existential level, and to work through that moral injury in a way that I just was having difficulty doing in any other with any other tool. And it was such a profound shift for me. I was able to get off all my medications very quickly and easily, and that week actually that I did that, my wife said, "I feel like I have my husband back again." So it was such a yeah, profound shift for me, and that process has been unfolding. There's still lots of healing that I had to do, have been doing, and continue to do. So it's not a complete magic bullet by any means, but it was what helped me get over the hump and really start on a kind of just a different direction that um, gave me hope, and was so such a profound shift for me. I can't put it in another term. So I was so fortunate to find IPI. I was in the second cohort, and I didn't know how I was going to be able to practice this work. And but then Oregon started to legalize psilocybin, and I was a big part of a lot of campaign efforts in Oregon to bring that in and bring it into my county as well. And I've been just so fortunate to be a part of the start of the psilocybin program in Oregon, and helping to train other uh, health professionals in psychedelic assisted therapy, and really learning so much. Um, and so I'm excited to share with you what we've put together, and what we've been finding. So.
Thank you, Drew. And so I'll go ahead and share my screen now, and we'll walk through the program. I did want to highlight, we're talking about, Drew's in Oregon, and IPI is based out of Colorado. I'm sitting in Colorado today, and uh, the IPI program is approved as a Oregon psilocybin facilitator training program. Right now, Oregon does have a residency requirement until 2025, I believe, that you have to be a resident of Oregon to even apply to become a facilitator. And so once that goes away, obviously that'll open up more. But IPI is a approved program for those living in Oregon and pursuing facilitator license. And Colorado has some draft rules. We've legalized psilocybin as well here, and our rules will be finalized by the end of this year. And so IPI will be looking to participate as an approved training program here in Colorado. But that's as far as we've gotten so far. So I'll go ahead and share here, and we'll get going. Here we go. And here are the learning objectives for today. So we're going to be reviewing the core structure of the program, and we'll be talking about basically the process of going through the program, the different types of groups you'll be engaging in, the types of lectures. We've also included a later part in these slides, and maybe we can make these available to you, because we have linked in some sample the schedules for what the practicums look like. So you'll be able to see, and Drew's going to share a little bit more about Oregon. And then I think I've also included a link to kind of a sample curriculum summary for our most recent cohort, which is still ongoing, cohort 6. And also included a list of the titles of the lectures that we have within our program. So you'll kind of get this, take a look and see the topics and faculty that we have engaged in the program. Here's a list of our core competencies. And so our program is pretty robust. It's 250 hours. And so it's quite a bit of an undertaking. Now, it's not 250 live hours. This includes asynchronous work as well. We run, and we'll get a little bit more into those details here. We run 2 cohorts per year. One starts at the end of January and runs through the end of October. The other cohort starts end of July and runs till about mid to late May. And so we do have for a period of the year, we have 2 cohorts running at the same time. I did want to say also that, we often recruit within our graduates to participate as group facilitators. Sometimes we find new faculty to lecture within our program that are from our graduates. So we're always kind of searching for this new voice, this new perspective, something fresh that we can introduce into the program. Our program is a clinical program, so there is definitely all of the research is kind of the foundation of the program. So it's a clinical program, and we do pull in a little bit of the spiritual aspect, a little bit of the indigenous aspect, mostly looking at the historical context or use in this case, looking at the historical context of psilocybin. We also have some Dr. Joe Tafur talks about ayahuasca and the healing potential of that, all the way down to the research that he's doing and the epigenetics aspects there. So we try to pull in a variety of things to try to give you kind of a well-rounded education. So as soon as you register for the program, you will have 20 hours of asynchronous content. So we had 20 hours of lectures, and this includes a lecture from Gabor Mate. We have lectures on pharmacology, lectures on ethic, transference, countertransference, some foundational aspects. We also have about a 4-hour module that's included in the prerequisites that is specifically based on psilocybin and the group dosing model and all the rules associated with that for the state of Oregon. So we do provide kind of a start to finish on what it would look like to work in a group if you were following all the rules in the state of Oregon. But Drew will speak a little more directly to actually what is the IPI practicum experience. Before the program starts, as soon as you register, we have pre-cohort roundtables, and these are every 2 weeks leading up to the start of the program. I host those meetings, and this is an opportunity for students to come in, share a little bit about their story, start to feel connected to community, and to ask any questions about the program, whether they're logistic or just start to explore expectations for the program, or really any psychedelic related conversations are always welcome. We kick off the program on a Friday and Saturday, and we have 2 days of lectures during that kickoff, and that is a live lectures. And so all of our lectures are live. The majority, every once in a while, we have to throw in a recording, but you have 37 lectures and they are weekly live. You can watch those after the fact. You do not have to attend the lectures live. There's no attendance requirement for that. But with that said, just know that every lecture, whether it's pre-recorded or live, does have a quiz associated with it and a survey associated with it so that we can receive feedback on the quality of the survey and how it's impacting your learning experience. In addition to the weekly lectures, every other week we have seminars, and seminars are more of an interactive where we can see everybody's faces in the space. We break up these seminars into 2 groups, and so we have a Wednesday PM offering and a Thursday morning offering. It's the same teaching, it's just offered twice, and you would register for the one that worked best for your calendar. Those seminars are interactive. Usually there's a portion that's teaching, and then there's quite a bit of open time for Q&A, interacting with faculty. And oftentimes there's a breakout group, or there may be a role play. We know that role plays aren't very popular. And so there may be a little bit of role play, and oftentimes there is a reflection, whether it's based on just the topic, say it's ethics, and there's a case or there's a critical thinking case, and we'll ask you to reflect on that in your small group. And then we bring everybody back into a large group, and we can continue the conversation and ask questions around what's being presented. And I did list all of the seminars in the documents that are linked at the end of this presentation, so you'll be able to look through and see what the topics are in those. And there'll be a couple of foundational seminars. Ethics, you'll have probably 2 ethics seminars, one at the beginning, one at the end. And then we'll have modules. We have the Psilocybin module, which is the first module in our program. Then we go into ketamine, and then we have the MDMA module at the end. After that, we have special topics that can include things like maybe an expanded conversation on internal family systems and integration, music, and how music is a supportive process in this work. And Mendel Kaelin does that presentation for us. And I know in the past we've had a talk on 5-MeO-DMT and ibogaine, and some work that's being done with veterans. And so some of those topics fluctuate depending on faculty availability and student feedback. Every other week, opposing the seminar week, we have home groups. And so home groups, you have 18 live online sessions with a home group facilitator. Home group facilitators are faculty that have been through our program, and they run these small pods. And so these groups are limited to 10 students, and you will meet every other week. And this is a space for you to create community, to reflect on the content of the program. And it's really important aspect of the program. And we found that the experience in the home group really dictates the experience in the program. And so making sure that we're feeling connected and at home within these groups goes a long way to how engaged our students are in the program. The practicum is live and in person scheduled. These are usually scheduled at the start of the cohort, right after the kickoff. We have the Psilocybin in Eugene, Oregon, which is a 4-day format, and ketamine in Boulder, that's a 2.5-day format. Let's see, and then the program graduation is a second intensive, very similar to the first, and that's also on a Friday and Saturday. So maybe I'll hand it over to, I'm gonna do the ketamine, and then Drew will do psilocybin, and I know you have some pictures and things to share. Okay. For the ketamine practicum, so as you're coming in for the ketamine practicum, it's located in Boulder, Colorado, 2.5 days. It starts early on Friday and ends at 1 o'clock on Sunday. In order to participate in the ketamine practicum, since ketamine is a drug that needs to be prescribed, you have to become a patient of the clinic. The Integrative Psychiatry Center clinic is the space where we hold the practicum experience. It has a beautiful large training yoga room, and we have about 8 offices within the suite. So we have a really nice setting where our students can have not only the group process that we hold, but also their individual triad experiences. And so as you're coming in, you'll be having a medical consultation, an appointment with our doctor to get you medically cleared and have that medical justification for being able to administer medicine to you. So you'll have to go through the process just like a client would. You'd become a client for that one time when you're receiving ketamine. As you come in, you're going to play the roles of client, therapist, and witness during your time at this experience. This experience is staffed. We have a nurse on site, and we also have a physician on site for the weekend. We'll have 2 faculty leading the weekend, and they'll be responsible for holding the therapeutic container, meaning that they're responsible for everybody that's receiving ketamine and is there for that weekend. We also offer after hours medical support. Our doc remains on call, as does the leads for the weekend. Really briefly, and I won't open the schedule here, but you'll have access to it. Friday morning is focused on building the container and doing a mini med consultation with the physician and the nurse. You'll be discussing your dose and to see if anything has changed for you medically. Our medical staff works really hard to make sure that everybody that is planning to receive ketamine can receive ketamine. Oftentimes coming to Colorado at elevation can cause a little bit of blood pressure increase, and they'll work with you on that, and sometimes utilizing medication to get you to a point where you can receive ketamine. IPC and IPI overall operates on a conservative protocol when it comes to ketamine. And so the doses that we're working with are usually at 0.5 milligrams per kilo of body weight. So we're starting on the lower side. We also utilize ongoing pulse ox on your finger so we can monitor your vitals. We have teaching assistants that roam the space and drop into the sessions. And sessions are also monitored by the leads to ensure safety in everybody's experience. Friday afternoon, we start the first dosing session, and at the end of the day, we have a group process. Saturday mornings, we start with a restorative yoga practice, a little group process, and then we go into triads for the morning dosing and then the afternoon dosing. During those dosing sessions, we start with a prep session. And so part of what we cover on Friday is preparing you to participate as a therapist, meaning we'll be talking about how do we run a preparation session and getting you ready for that. So the first hour of the experience is a preparation session, followed by a 2-hour medicine session. The ketamine is administered intramuscular, and that's how we administer the medicine there. And their student schedule was there, and I will go back here on the slides so that Drew can talk about the psilocybin practicum.
Awesome. Yeah, the psilocybin practicum is taking place in Oregon since there's a legal model and framework for doing it in Oregon. And it's a non-medical model in Oregon, and so there's certain rules and things that we have to follow in order to do it, and including it has to take place at a licensed service center, and so IPI has a service center in Eugene, and the way that we run this is about 20 to 24 students come in on Tuesday, and we spend a lot of time really building a group container and trying to sink in together to start to build safety with each other within the group, and create a space that everyone can feel really vulnerable and feel completely comfortable for the day that they are going to be dosing. And a lot of people feel really nervous and maybe anxious going into a group experience, especially with peers, other professionals, and they're what am I gonna say or do? What's this gonna look like? But we have been able to really create a model with this that is so beautiful. Everyone leaves saying that it's one of the most profound experiences that they've ever had, and that maybe they were really hesitant about having this experience in a group, and like most people, when they leave, they say, like, I'm rethinking everything. I thought I wanted to do this just one-on-one, that was going to be the main model, and now I'm realizing the power of community and the power of witnessing each other in this communal space, and how healing that can be. And it's just so amazing to witness every practicum that we run, and we're doing 1 to 2 a month right now, and it's so amazing to be a part of it and see how these groups can come together and how much profound connection and healing happens in this learning environment, because this is a practicum where you're learning. So we spend a lot of time on that first day really making sure everyone is feeling prepared, and there's individual preparation calls beforehand, and screening, and make sure that everyone really feels prepared as they come into the practicum. And then on day 2 and 3, there's the dosing days. And let's go to the next slide so we can see the group room. So this is the group room, and we converted an old yoga studio, and as you can see, we have it set up to where everyone is able to witness everyone else who's journeying, and we pair people up, very informally, but just so that there's someone who they're mainly kind of witnessing and providing support to, in just supportive presence, really, while they're watching the licensed facilitators and work with anyone who's needing it. And so we walk around in the middle there, and then we'll come in and we'll work with anyone who's needing assistance. And then all the witnesses can watch as we do that. We have an incredible staff of facilitators who is just such an amazing team. And by having this communal experience, you get to witness the spectrum of human experience. You get to see people who are working through grief or trauma, or having some transcendent experience of bliss and joy, and those things can be happening simultaneously in the room, and it just ripples through the room. You can feel the energy, and it all becomes this like beautiful tapestry that's being woven by everyone together. And we've coined a phrase that I think is so amazing, which is vicarious healing. When we get to see other people healing and bear witness to that, and we're all on our individual journey, but there's so much beauty that can happen when you are present for that and supporting of everyone else's, and they're supporting of you, that it amplifies it. And so the group has this experience of like amplified awe and amplified just profound experience that really I haven't seen replicated anywhere else. So while you're going on this individual experience and journey, it's happening in this communal group context that's so beautiful. So we call those nests, and we try to make everyone feel really comfortable. There's weighted blankets and different types of blankets. And let's go to the next slide. I'll show you. So this is one of our little central mandala pieces that we build as a community. So one of the things that we do is create ceremony to really help this be a intentional experience for everybody, and so everyone can get the most meaning out of it that they are looking for. And so we build these things together. On those ledges on the wall there, we call them our ledges of intention. Everyone places something that represents their intentions up on those ledges, and we have like a ceremony to open the container and to build that together. And then on the journey day, we build this mandala with things from nature and just different pieces that are from whatever's happening, and we try to bring as much nature as we can, and we bring plants in, and because we know a lot of people want to connect with nature when they're on psilocybin. So it can be hard to feel like wow, we have to be in a room the whole time, but it ends up being so incredible. It's not like the only way to do this, but it is such a beautiful way, and to really go deep and really be held in a container of safety. And I think one of the biggest learning pieces is in how to do this, just in 4 days, create this really close-knit profound experience as a community and connect with each other, and then be really vulnerable as you open things up and heal from them. You know, and so, many times there's challenging experiences, and I have found that to, if you can have that challenging experience and be held by the group, then it's so much more opportunity for healing than if you were just one-on-one. I think it can feel really isolating to feel like, oh, I just had this really challenging experience, and you know, am I crazy, or what was that? And but I think when you're seeing the group and the diversity of experience, it can feel really settling, and help you to unfold meaning from that, and so it's something really great that we are drawing from to create this experience, this practicum for the students. So was there anything else, Jamie, that I'm missing that we want to mention about that?
No, I think you covered it well. I think that the nice aspect of the group, I think there can be, you know, coming in, if we haven't sat in a group and we haven't sat with psilocybin or other medicines in the group, there's could be a lot of anxiety as we're thinking about coming into the experience. One, maybe it's our first time, and also the layer of being with your colleagues, right? And feeling like, well, we have to hold a certain level of composure, and we're the ones that's just supposed to be healthy and help others. And so oftentimes we find that part of these experiences, the same thing happens in the ketamine weekends, is the challenge is for how can we create a space that will allow you to receive care? And how can we create a space where you're willing to say, yes, I can receive this over these next 3 or 4 days? And the power of the group experience is that, like you said, I don't have to hold my experience in isolation, wondering if it was a weird one, a normal one. And I think it's really validating to see the spectrum of experience from, you know, mystical to grief to laughter, to a very subtle non-experience. And what is it like to hold all these experiences and to be able to share those in the group? And so if we're able to come into these, whether it's psilocybin or ketamine, and to offer our own experience, whatever that may be, whether it be mystical, grief, non-experience, or laughter, if I can hold my experience as an offering to the larger community, and then I don't have to own it personally, right? I can share it with everybody as an opportunity for learning, right? So I get to learn from 23 other students' experiences, and where else can you observe 23 other experiences in such a short time? And so the group in Oregon caps out at 24 students. And so there's 12 students receiving psilocybin, 12 students sitting, and then the staff supporting the legal structure of facilitation. In Colorado, the groups, I think, max out at 27, I believe, 27 or 29. I think it's 27. And so, and then you're put into triads there. And again, the same thing in Colorado for the ketamine. We have a beautiful kind of altar, and folks are invited to bring their items to anchor their intentions for the weekend. And also the ritual of creating something of a shared altar in the center of the space is also something that's been introduced recently from a learning of what's happening in Oregon. So it's really nice to learn from the two practicum experiences.
Yeah.
Also knowing that they're very different settings and experiences. And so what happens in Oregon and how you experience Oregon and how Oregon is held is very different when you're sitting in more of a clinical model right? We have a non-medical model in Oregon, and then we have a medical model in Colorado during the ketamine experiences. And so one of the funny things we've seen is that as students have started going to Oregon, they come into the experience in Colorado and want it to be just like Oregon. And so we're having to navigate those differences, and we're trying to align both experiences as we learn going forward.
Hey,
I
Jamie,
did want to,
before
yeah.
you go on to the rest of the schedule, could you clarify, are the practicums required?
Oh,
Can you
right.
sign up for both? How does that work?
Yeah, so you can sign up for both practicums. So you can complete the program and not participate in a practicum, and you can get a certificate of completion in that process. If you participate in the Oregon Psilocybin Practicum, which is the primary practicum for certification, and you complete that process, then you'll be eligible for certification. Ketamine is an additional experience if you want to experience the differences between those medicines. If there's a medical contraindication saying like perhaps I can't participate in psilocybin, but I can do ketamine, and then we would work with you. We try to accommodate our students as best as possible as things come up and life comes up. If for some reason there's a hardship and you can't attend one, but you can attend the other, we can try to find a way. You know, our goal is to get you to the completion of the program and to support you in certification. And sometimes we'll make small adjustments for students that are having life experiences that prevent them from fully participating somewhere. I also wanted to clarify that you do not have to receive psilocybin nor ketamine in order to fulfill the practicum requirement. The requirement is for the program is that you observe and sit for your fellow student in a non-ordinary state. And so in ketamine experience, that means that you have to participate as a therapist with a client in a non-ordinary state. And then in Oregon, that means that you have to be present in the space and hold space for your fellow students that are actually ingesting the psilocybin.
Okay, great. And are the practicums open to people that don't complete the 1-year online program, or do you complete that first?
So it's ongoing, and so as you're going through the program, you will be scheduled and you'll participate at some point throughout the program in the practicum. And so the practicums are closed to current students enrolled in the program. It's the service center in Oregon doesn't provide services outside of the training program, nor the ketamine experience in Colorado is only open to current students.
Great, thank you.
You're welcome. And so as you see up on the slide, this is our upcoming cohort. Right now we have cohort 6 going on, and that'll end, when will that end? That will end in October. Cohort 5 is graduating here soon in May. Cohort 7 is kicking off at the end of July. And you can see kind of the schedules of when your lectures and times, days and times are here. These are mountain time, you know, so it's mountain, it's based in Colorado time, so it's mountain time when you look at these, starting to think about if you are curious about the program and looking at, is this going to work with your schedule? This is what it would look like. I did want to say, I don't know if I mentioned before, we do have office hours every other week of the program. And that's basically an open hour. I usually staff those where students can come and ask any questions regarding the content of the program or any questions in relation to the program. Sometimes we discuss clinical cases of students who are already working with clients. So I just wanted to share that. And so we have a syllabus document here for you. I do have maybe a curriculum summary. I'll try to open that here shortly so you can get a snapshot into what the program encompasses. I did want to summarize the communication. And so after every module, so after every lecture, you'll be able to rate the lecture, and we review that. All of the leadership reviews that feedback formally. After each medicine module, after the the psilocybin, the ketamine, the MDMA, you will have an opportunity to rate the faculty that did the teaching and how relevant the content was and the quality of the content. And we take that into consideration, track the scores, and we do adjust faculty based off of student feedback. We have the office hours, and we also have a community forum that's an open forum where students can connect with each other, share resources, and try to collaborate on making up any assignments that may be missing. And so I'm gonna see, can you see this okay, Ali? Yeah. Okay, great. And so this document's available to you, and we'll make this slide deck available to you. And so there's a course description, here's the certification requirements. And so I'll just scroll through this slowly. And so what you're looking at now is a prerequisite lectures. You can see the types of topics in there. We have ethics, intro to DEI, structural racism, and some of these change as we go. Some of these may become outdated, and we'll replace them with new lectures. We also have supplemental materials, and so sometimes have your prerequisite lectures and then the ongoing weekly lectures and seminar content. And on occasion, we'll drop additional lectures, supplemental lectures into a side module called supplemental lectures. And sometimes that could be, I think we have like recordings of ketamine sessions or psilocybin sessions, or we may have additional talks that feel relevant that we'll get. We don't have a space in the schedule for them, but we want our students to have them, and we'll add those materials in the supplemental. And so you can see that, and then we roll into the weekly lectures. So what we're looking at here, this would be kind of what a kickoff weekend would look like. We had Roz Watts with the ACE model of depression, and you can read through these at your leisure. I do want to leave some time for questions, and so I'll just scroll through this slowly, but just know that you have access to this document along with a syllabus that talks a little bit more about just the structure of the program. As you can see, all of the MDMA content is in there. There you go. And we end, usually we end it with a lecture on death and dying and palliative care by our lead doc, Rohini. And then the group seminars here, you can see professional development, ethics, ketamine, psilocybin, MDMA, ethics, and some of these special topics do change from time to time. But I'll go ahead and stop my screen share now, and we can open up for questions.
Okay, thank you so much. This was very informative. We have several questions coming in, which we'll go ahead and get to, but I just wanted to let everybody know that I was dropping the links in the chat for some of the documents he shared. We also send out an email follow-up with the video, and we'll include all these links in the slides again, so you'll have the information in your email. So the question I think I'll start with is, could you go over the credentials to apply and be a part of this program?
Sure. And so we're looking for mental health professionals that are licensed, so LPC, LMFT, social work. I think we also, I'll have to confirm, I think Masters of Divinity, MDs, DOs, nurse practitioners. Folks on the medical side need to have at least 1,000 hours of mental health contact related work. For Cohort 7, we're actually we're allowing folks on the medical side that don't have that degree of mental health experience. We're calling it the medical track. And so those folks will participate in the program just like everybody else, but there's seminars. And so the 2-hour interactive seminars will be separate on a separate day for our medical professionals, just knowing that we'll have to tweak the language, and probably the conversation and questions will be slightly different. And then for the medical track, the experientials, I think we're also trying to hold the experientials differently because the format will likely be a little different. So we wouldn't be asking a doctor to come into a ketamine practicum and asking them to suddenly become a therapist for that moment. And so we're looking at shifting the format of that experience to align more with the medical professional, adding a little bit more of the medical education on how to work with ketamine during those experiences. So there'll be a little bit of separation, but overall they'll be completely integrated into the program.
Okay, great. Thank you. So we'll go ahead and get to the QA box here. So our first question is asking, as someone with a hard sciences background in aerospace, what is your opinion on the value of various specializations in the field, particularly comparing and contrasting research, pharmacology, neuroscience, nursing, business therapy, and technology? So I think as this relates to your program at IPI, is this a specialization in any of these aspects, or do you kind of touch on all these different topics around business, therapy, research, how to do this legally in different states, things of that nature?
Yeah. Yeah, so we do, yeah. I think of it as kind of a broad umbrella. We dive into the research for each of the medicines. We talk uh, we do usually have one or two talks on the legal landscape of what's happening currently internationally and with specific states kind of leading the way here in the United States. So we talk about that specifically as well. And what was the other aspect of that? Special, yeah. I do think I don't think of it as is it a specialization in psychedelic therapy? It is a I think it is a special skill. I think part of the education is also one, not only to, we may not specifically sit down and end up facilitating these experiences. And I think part of the learning in this program is learning kind of our inner work, where we are in this process. And as we have our experientials and then looking at, wow, is this something that I really want to do myself? Or is this something I want to support people in their preparation and in their integration? I think a lot of the work that happens in the psychedelic space in private practice for the majority is our clients are going off and doing these experiences elsewhere. And they're coming to us looking for support on one, I'm thinking about doing this, so how do I prepare? So having an understanding of what these experiences may be like and what my challenges in learning were so that I can support my client in that process. And then the integration aspect, how do I help this individual find bringing these things back into life, into their lives? And so I don't know if I answered the question that great, but I think I touched on it a little bit.
Sure, sure. Thank you. So there's several questions are asking about any idea, say, if the certification is going to work for Colorado, let's say California, where I live, comes with some
Yeah,
new legislation. Will people that have already completed the program potentially be able to apply once these states, let's say,
right,
have
right.
different rules?
Is there going to be reciprocity in the education? For Colorado, for Oregon, there is. We've already established that. For Colorado, Will Vanderveer has been involved in the conversations around the rules. And so the hope is, so in Oregon, when Oregon came online and we got approved as a program, we reached out to all of our Oregon graduates and said, hey, there's a process for you to get your facilitator license. We'd like to support you in that process. And we created a module and streamlined a version for them to reach that. We're likely going to do the same thing in Colorado for our graduates. When we see what the final requirements are, we're going to see what is the shortest pathway that grants credit for everything that has been accomplished. And we'll be supporting our Colorado graduates in that process. And so as far as other states, we'll provide any documentation that we can to support you in your process as new states legalize this. But we don't know what that's going to look like.
Right. And I imagine the same is true for FDA approved medications that may
Yeah,
be coming, such as MDMA or psilocybin.
right.
Okay.
Yeah,
That's great. Does make sense. People should get credit. And I know there's such a huge need for health providers that have been well trained to be able to get right into practice with these medicines. And it's worth mentioning, you do cover ketamine as part of this program.
yes.
There are no federal training requirements or state requirements. So once you complete the IPI program, you'll be well prepared to integrate ketamine into your clinical practice.
Right. And part of the program, what we're going to be adding here this summer is, we have an alumni program that we've been working on that's been slowly growing. And part of the offering that's going to be coming going forward is a consultation group. And so we're looking at how do we provide an ongoing consultation group for our graduates as they start to explore, how do I bring this into my practice? So that can be a part of the conversation, being supported that, and also any clinical cases and reflections that you're trying to work with, you can also bring that back into the community and feel supported in that process.
Great. I'll also give a little plug for Psychedelic Support. We have a network of over 2,000 health professionals, and it's free to join. And we also have a part of this called Professional Connect. So if you're looking for a prescriber or another therapist to work with, or just want to network in other ways, it's all free, and you can check it out on our site. In addition, there are quite a few questions about, do you need to be a therapist or have a psychology background? I believe we answered this. It is pretty specific for the IPI program. There are several courses on our website where you can join and do on-demand work. You don't have to have any particular qualifications. There's also the Polaris Insight workshops we offer on our site where you can join with any type of background. I will say the material is at the level of a master's or graduate level. So you might want to do some of the foundational courses to feel like you can fully understand the content being presented, but there are options and many other programs coming on board for facilitators of different backgrounds, which I see all have a place in this field. And it's great to have this multidisciplinary type of professionals coming into the space. Could you talk a little bit about the pricing of the program?
Yeah, I did not look that
Oh,
up to see where it's
okay.
at. It's on the website,
Yeah,
I
so I'll
believe.
drop it in the link again. And
Thank you.
there is an early bird pricing through the end of April, which is $7,000 for the core program. And there's an additional fee for the practicums, which were discussed here. And
Yeah,
just to restate, you can sign up for these as optional. I think if you want to become an organ facilitator, you actually have to complete one.
yeah,
That's what you're saying. Yeah.
yeah. You have to complete the practicum in Oregon. I thank you for asking about pricing. I did. That reminded me. I don't know how I missed this. That we do offer scholarship, and so we have a veterans scholarship that reduces the tuition by 35%. Those scholarships don't max out, meaning that we don't run out of the number of scholarships we can offer in those. And then you'll see on the website we have scholarships for marginalized communities, and you can find the details there. Those scholarships are 50% off tuition. Now, those scholarships do cap at a certain, like we can only hand out so much, and I don't remember if it was in the range of 30 or 35 or scholarships per cohort. I'm not yeah, too up to date on that, but 50% off the tuition. And so you can find the application on the website. It's first come, first serve. And so if you're even contemplating it, you want to be higher on the list there so we can get to you. And we do allow those to carry over to future cohorts. So if you want to take a look. And also I wanted to say, if anybody has any questions after this webinar, you can feel free to reach out. Our email addresses are on the last part of the slide deck. You can reach out directly and we'll get your questions answered.
Excellent. And you can schedule a complimentary call on the website as well. So they ask for a short application, and then you actually get to talk to the staff at IPI and go over additional questions, make sure it's the right program for you. I will say the cost, it is a high price point for training, but then again, it's an investment in your career. That's the way I see this, and the opportunities coming for professionals to integrate this into their practice. It does make a lot of sense to think of it, I think, that way of the value add there of getting these trainings early on. I think the competition is going to get much greater to get into programs, to establish practices. So this is, I think, a great opportunity for those that are the early adopters of psychedelic medicines and wanting to participate in this field early on. And it's great to see you two have done the training, now are included in the program to further educate others, your other peers. So that's a wonderful sort of cycle that's happening within the education of expanding this out to others.
Yeah. I know we're coming up at the end of time. I wanted to thank everybody who's joined us and has been active in the chat. I've seen the hellos and locations coming up. Again, reach out if you have any questions. You can email me directly. Thank you, Ali, for having us. Drew, did you have any?
Yeah, I also want to say thank you, and I'm excited for everybody who's thinking about this, and and hope that you come through and that I can share this experience with you. So
Thank you, Drew.
Fabulous. And we'll send out the email with the video, the slides, all the information shared today. I appreciate everyone's time together today, and look forward to doing this again next month with Matt Baggett. He's going to be talking about novel entactogens. So we'll have that information out soon as well.
Yeah, great. Thank you.
All right.
Thank you so
Thanks
much.
so much. Take care, everybody.
Bye-bye.